Hello, today we will discuss, does marijuana cause erectile dysfunction? And related issues. Marijuana is a plant commonly used in our country and around the world. It has been used for thousands of years for pleasure and getting high. Although it is easy to obtain in many countries, its sale and use are illegal in our country, while it is legal in some states in the US and some European countries. Does marijuana cause erectile dysfunction? Do drugs cause erectile dysfunction? There are many scientific studies, but among the scientific studies conducted, there is no study that clearly shows that marijuana causes erectile dysfunction and identifies the cause. A study conducted among chronic marijuana users in Turkey showed that the incidence of erectile dysfunction was 2 to 4 times higher than in non-users, but the reason for this has not yet been determined. In survey studies related to marijuana use, an increase in sexual arousal and an increase in erection quality during sexual intercourse have been observed. However, these studies are generally conducted among low or first-time users. Another bad side of marijuana use is that it can be a step towards using other drugs. Marijuana users may say, "Marijuana use has not caused a problem for me, it did not cause addiction. I can try others too." In my clinical experience, I have seen that among patients who complain of loss of sex drive, marijuana or other drug use is common. Some patients report that they do not have erection problems but have a loss of sex drive. This may be related to the dopamine release in the brain caused by marijuana or other drugs. Sex drive may be reduced because they think that the pleasure from drugs is higher than the pleasure from sexual intercourse. There is still no clear information about the cause and treatment of erectile dysfunction or loss of sex drive associated with marijuana use. Some patients who have used marijuana for years may still experience sexual desire problems years after quitting. These individuals can have sex but may not want to. They express this situation with tears and say that they have been like this for years. They want this situation to improve, but they indicate that it has not improved in any way. In such cases, intensive psychotherapy and medical treatment may be necessary, or couple therapy may be sought. Treatment in these areas is quite difficult because sexual desire is the most important and troublesome of sexual compatibility problems. This situation is difficult to overcome in both women and men, and finding the cause can also be difficult. Success is not guaranteed in psychotherapy, and the person may have to continue therapy for many sessions or days. Therefore, it is important to stay away from drugs. Thank you for listening. Regards.